TEAS test. Question 1. After Silver Group 9 reads a passage about hand hygiene during the exam prep review, which sentence states the main idea? Option A. Hand hygiene reduces the spread of infection. Option B. Gloves remove the need for soap. Option C. All microbes are harmless. Option D. Most infections begin at home. The correct answer is option. The selected answer fits because it summarizes the central point that clean hands protect patients and staff. Gloves remove the need for soap is wrong because the passage focuses on hand washing and does not claim gloves replace it, and all microbes are harmless is wrong because the passage treats microbes as a risk to control. Most infections begin at home is wrong because home exposure is not the focus of the passage. Question 2. When Silver Group 9 sees details that a passage says a patient has dry lips, dark urine, and dizziness when standing, which inference is most reasonable? Option A. The patient needs more noise. Option B. The patient has perfect hydration. Option C. The patient has improved vision. Option D. The patient may be dehydrated. The correct answer is option. The selected answer fits because dry lips, dark urine, and dizziness are consistent with low fluid balance. The patient needs more noise is wrong because noise has no connection to the symptoms given, and the patient has perfect hydration is wrong because the symptoms point away from good hydration. The patient has improved vision is wrong because vision is not discussed. Question 3. During Silver Group 9's exam prep review, a passage explains how a calculator policy works and gives examples of allowed use. Which author purpose fits best? Option A. To frighten readers away from testing. Option B. To tell a fictional mystery. Option C. To inform readers about a testing policy. Option D. To sell medical equipment. The correct answer is option. The selected answer fits because definitions and examples are used to explain information clearly. To frighten readers away from testing is wrong because the language explains rather than scares, and to tell a fictional mystery is wrong because the text is explanatory, not fictional. To sell medical equipment is wrong because no product is offered. Question 4. While Silver Group 9 outlines a passage that moves from registration to test day to score report, which structure is being used? Option A. Chronological order. Option B. Problem and solution. Option C. Cause and effect. Option D. Classification. The correct answer is option. The selected answer fits because the details follow the order in which events happen. Problem and solution is wrong because no main problem is introduced and solved, and cause and effect is wrong because the focus is sequence rather than results. Classification is wrong because the passage is not grouping types. Question 5. Before Silver Group 9 accepts the claim that reading directions carefully prevents mistakes, which detail gives the strongest support? Option A. One student wore a blue jacket. Option B. The test room was quiet. Option C. The school opened in 1998. Option D. In one review, most missed items came from ignoring words such as except and first. The correct answer is option. The selected answer fits because the evidence connects direction words with missed questions. One student wore a blue jacket is wrong because clothing is irrelevant, and the test room was quiet is wrong because a quiet room does not prove direction reading prevents errors. The school opened in 1998 is wrong because the school date does not support the claim. Question 6. Since Silver Group 9 sees the word concise in the tutor gave concise directions before the timed drill, which meaning fits the context? Option A. Brief and clear. Option B. Confusing and hidden. Option C. Angry and loud. Option D. Bold and fragile. The correct answer is option. The selected answer fits because concise means giving necessary information without extra words. Confusing and hidden is wrong because concise directions should be easier to follow, not hidden, and angry and loud is wrong because emotion and volume are not part of the word meaning. Old and fragile is wrong because age and condition do not fit the sentence. Question 7. Given Silver Group 9 answers 11 out of 25 practice items correctly, which percent matches the result? Option A, 22.73%. Option B 44%. Option C 56%. Option D 30.56%. The correct answer is option. The selected answer fits because 11 divided by 25 equals 0.44, and multiplying by 100 gives 44%. 22.73% is wrong because it uses the wrong comparison instead of dividing the part by the whole, and 56% is wrong because it subtracts before converting rather than converting the given fraction. 30.56% is wrong because it compares the part to the total plus the part or uses an incomplete setup. Question 8. If Silver Group 9's score rises from 80 to 92, what percent increase should be recorded? Option A 15%, Option B 13%, Option C 12%, Option D 115%. The correct answer is option. The selected answer fits because the increase is 12, and 12 divided by the original score 80 equals 15%. 13% is wrong because it divides by the new value instead of the original value, and 12% is wrong because it reports the raw point gain rather than dividing by the original value. 115% is wrong because it gives the new score as a percent of the old score, not the percent increase. Question 9. Suppose Silver Group 9 solves 4x plus 5 equals 41. Which value of x makes the equation true? Option A 9, Option B 10, Option C 36, Option D 8. The correct answer is option. The selected answer fits because subtracting 5 leaves 4x equals 36, and dividing by 4 gives x equals 9. 10 is wrong because it is one step away from the value that balances both sides, and 36 is wrong because it treats the constant or coefficient as if it were the final answer. 8 is wrong because it reverses or skips part of the inverse operation. Question 10. Using Silver Group 9's triangle diagram with a base of 10 cm and a height of 6 cm, which area should be recorded? Option A 32 cm, Option B 30 square cm, Option C 60 square cm, Option D 16 square cm. The correct answer is option. The selected answer fits because triangle area is 1/2 times base times height, so 0.5 times 10 times 6 equals 30. 32 centimeters is wrong because that resembles a perimeter calculation and uses the wrong units, and 60 square cm is wrong because it forgets to take half of the base height product. 16 square cm is wrong because it adds dimensions rather than using the area formula. Question 11. From Silver Group 9's measurement note of 750 ml, which conversion to L is accurate? Option A 0.075 L, Option B 75 L, Option C 7.5 L, Option D 0.75 L. The correct answer is option. The selected answer fits because 1000 milliliters equal 1 liter, so moving the decimal 3 places gives 0.75 L. 0.075 L is wrong because the decimal is moved 1 place too far, and 75 L is wrong because the decimal is moved in the wrong scale. 7.5 L is wrong because the decimal is moved only 2 places. Question 12. In Silver Group 9's score set 79, 85, 72, 58, 86, which median should be reported? Option A 86, Option B 58, Option C 79, Option D 76. The correct answer is option. The selected answer fits because the scores are ordered as 58, 72, 79, 85, 86, and the middle value rule gives 79. 86 is wrong because it selects another listed score instead of the central value, and 58 is wrong because it is an extreme value or unrelated value rather than the middle after sorting. 76 is wrong because it uses a mean-like or added value rather than the median method. Question 13. For Silver Group 9, 3 review packets cost $6. At the same rate, how much do 6 packets cost? Option A, $12. Option B, $10. Option C, $18. Option D, $12. The correct answer is option. The selected answer fits because $6 divided by 3 gives $2 per packet, and 6 packets cost $12. $10 is wrong because it is 1 unit price short of the proportional cost, and $18 is wrong because it multiplies the two quantities and ignores the price. $12 is wrong because it adds the new quantity to the old cost instead of finding the unit rate. Question 14. Near Silver Group 9's cell control review, which organelle matches the function being reviewed? Option A, ribosomes. Option B, nucleus. Option C, cell membrane. Option D, mitochondria. The correct answer is option. The selected answer fits because the nucleus contains DNA and directs many cell activities. Ribosomes is wrong because ribosomes make proteins, not genetic instructions, and cell membrane is wrong because the membrane controls movement in and out but does not store most DNA. Mitochondria is wrong because mitochondria make ADP and contain only small amounts of their own DNA. Question 15. Because Silver Group 9 traces circulation and blood leaves the left ventricle, where does it go next? Option A, pulmonary veins toward the lungs. Option B, aorta toward the body. Option C, pulmonary artery toward the lungs. Option D, vena cava toward the body. The correct answer is option. The selected answer fits because the left ventricle sends oxygenated blood through the aorta to systemic circulation. Pulmonary veins toward the lungs is wrong because pulmonary veins return from the lungs to the heart, and pulmonary artery toward the lungs is wrong because that path starts from the right ventricle. Vena cava toward the body is wrong because the vena cava returns blood to the heart. Question 16. Although Silver Group 9 sees alveoli drawn as tiny sacs, which feature helps oxygen enter blood quickly? Option A, a large surface area. Option B, a small surface area. Option C, a sealed membrane with no blood flow. Option D, a layer of enamel. The correct answer is option. The selected answer fits because many tiny sacs create more area for oxygen and carbon dioxide to diffuse. A small surface area is wrong because less area would reduce gas exchange, and a sealed membrane with no blood flow is wrong because blood flow is needed to carry gases. A layer of enamel is wrong because enamel is tooth tissue, not lung tissue. Question 17. Once Silver Group 9 notices that dehydration increases and thirst becomes stronger, which process explains the response? Option A, genetic drift. Option B, homeostatic regulation. Option C, blood clotting cascade only. Option D, a mechanical digestion. The correct answer is option. The selected answer fits because thirst motivates fluid intake to help restore water balance. Genetic drift is wrong because genetic drift is a population-level allele change, and blood clotting cascade only is wrong because clotting is not the water balance response. Mechanical digestion is wrong because mechanical digestion breaks food into pieces. Question 18. Where Silver Group 9 studies genetics and a heterozygous tall plant TT crosses with another TT plant, which offspring chance matches the expected result? Option A, 50%. Option B, 75%. Option C, 100%. Option D, 25%. The correct answer is option. The selected answer fits because TT and TT genotypes show the dominant tall phenotype in 3 of 4 outcomes. 50% is wrong because 2 of 4 are heterozygous but phenotype is not limited to carriers, and 100% is wrong because 1 outcome is TT and would not be tall. 25% is wrong because 1 of 4 is the recessive short phenotype. Question 19. As Silver Group 9 reviews chemistry and an atom has 11 protons, which conclusion follows? Option A, its mass number must be 11. Option B, its atomic number is 11. Option C, it has 11 electron shells. Option D, it has no charge. The correct answer is option. The selected answer fits because atomic number equals the number of protons in an atom. Its mass number must be 11 is wrong because mass number equals protons plus neutrons, and it has 11 electron shells is wrong because shell number is not determined directly by proton count. It has no charge is wrong because charge depends on the proton-electron balance, not proton count alone. Question 20. Under Silver Group 9's experiment testing whether light color affects algae growth, which setup is the control group? Option A. Algae kept under white light while all other conditions match. Option B. Algae placed in a warmer room only. Option C. Algae that are never measured. Option D. Algae with different water and different light. The correct answer is option. The selected answer fits because a baseline light condition with matching variables allows fair comparison. Algae placed in a warmer room only is wrong because temperature becomes the tested factor instead of light color, and algae that are never measured is wrong because growth must be measured to compare results. Algae with different water and different light is wrong because changing water and light prevents isolating the cause. Question 21. Between Silver Group 9's grammar options, which sentence uses subject-verb agreement correctly? Option A. Each of the practice questions were an explanation. Option B. Each of the practice question has an explanations. Option C. Each of the practice questions have an explanation. Option D. Each of the practice questions has an explanation. The correct answer is option. The selected answer fits because each is singular and takes has. Each of the practice questions were an explanation, is wrong because were does not fit the singular subject or meaning, and each of the practice question has an explanations, is wrong because question and explanations have number errors. Each of the practice questions have an explanation, is wrong because have incorrectly agrees with questions instead of each. Question 22. Inside Silver Group 9 sentence, the team updated blank schedule after the review. Which pronoun should replace the blank? Option A, dits. Option B, dits. Option C, them. Option D, they. The correct answer is option. The selected answer fits because team is a singular collective noun in this sentence, so it fits formal agreement. Its is wrong because it means it is and cannot modify schedule, and them is wrong because them is an object pronoun. They is wrong because they is a subject pronoun and does not show possession before schedule. Question 23. Through Silver Group 9's punctuation review, which sentence uses a semicolon correctly? Option A. Maya studied science, Jordan reviewed math. Option B. Maya studied science, Jordan reviewed math. Option C. Maya studied because science was hard. Option D. Maya studied science, Jordan reviewed math. The correct answer is option. The selected answer fits because both sides of the semicolon are complete related sentences. Maya studied science, Jordan reviewed math is wrong because the mark separates the subject from the verb, and Maya studied because science was hard is wrong because the second part is not an independent clause. Maya studied science, Jordan reviewed math is wrong because the first part is a run-on before the semicolon. Question 24. According to Silver Group 9's grammar check, which revision fixes the run-on sentence? Option A. The calculator worked, the answer still needed estimation. Option B. The calculator worked because the answer still. Option C. The calculator worked, the answer still needed estimation. Option D. The calculator worked, the answer still needed estimation. The correct answer is option. The selected answer fits because a semicolon correctly connects two related independent clauses. The calculator worked because the answer still is wrong because the second part is incomplete, and the calculator worked, the answer still needed estimation is wrong because the comma alone creates a comma splice. The calculator worked, the answer still needed estimation is wrong because there is no punctuation between complete thoughts. Question 25. Beyond Silver Group 9's vocabulary drill, which meaning does the prefix Brady - add? Option A, fast. Option B, above. Option C, inside. Option D, slow. The correct answer is option. The selected answer fits because Brady means slow, as in bradycardia meaning a slow heart rate. Fast is wrong because fast is tachy - and above is wrong because above can be supra or hyper depending context. Inside is wrong because inside is endo -